This was a unique project. I've never done one like it in 30 years in construction. Firstly, we were building a facility that nobody really wanted to see used. This was an insurance essentially for the NHS that they would have the capacity for a COVID response should the rate of infection and therefore patients escalate drastically. The second aspect that made this most unusual was, of course, that we had to adopt social distancing rules to try and keep ourselves safe by separation from each other. There were at least 900 people on site at peak, and it is a very big facility, but nonetheless, in corridors and stairways, we had to make special measures to try and keep ourselves apart. So one-way systems were introduced. For instance, we marked out certain seats in the auditorium that kept people 2 meters apart. There were no handshakes, even at the end, and we were coming across all sorts of problems in the electrics to the fact that the ventilation system was of a standard sufficient for a conference or an exhibition, but that's not the same as it being the ventilation or air handling system for a hospital, especially one that's dealing with respiratory illness. And yet all of these hundreds of challenges, many in the first week, the team pulled together and overcame every one of them. There was no challenge that we didn't overcome. And I think everybody that's been involved in this has done so well to overcome hundreds of problems and achieve the over 1,000 clinically approved bed facility in just 3 weeks.